In summary, price competition is the only mechanism available to the free market for containing costs. If free market healthcare is to be preserved, price competition must be generated. It's the only way. To create price competition, decisions have to be made by an entity having an incentive to practice thrift. In other words, whoever chooses, the only entity or person with an ethical right to an incentive to practice thrift in their healthcare decisions is the patient themselves. For anyone else in the market to do that on their behalf creates an unacceptable conflict of interest. The only way a patient can safely practice thrift in their own healthcare decisions is through a cooperative arrangement with their doctor and insurer as outlined in the Vernier model of healthcare delivery. In conclusion, the Vernier model of healthcare delivery is the correct approach to inexpensively solving the healthcare crisis, preserving free market healthcare, and protecting the rights of the individual consumer. Now, I would like to discuss the disadvantages of this plan, because no plan is perfect, and there is some problems associated with this. First, there is a potential for fraud and abuse, as there is in any system. But some people would be tempted to try to obtain a cashback bonus by faking illnesses or symptoms, and if doctors received a little bit of money for their trouble, they might be inclined to go along with that. So I think cashback, at least cashback paid directly to a patient, would have to be limited to cases where it could be objectively proven that those symptoms did exist through lab work or x-rays or CAT scans and so forth. And more subjective symptoms like back pain, fibromyalgia, mental health issues might have to be limited in the way that the cashback bonuses were paid. They might have to go towards a reduction of premium or some way that didn't offer such an incentive to falsify symptoms. The other thing is that there would be a considerable amount of resistance from organizations, companies, suppliers of healthcare, insurance companies that would not want to be faced with price competition. However, we're not asking these companies to go out of business. We're simply asking them to accept the same business conditions that businesses all over the world have to face every single day. This is not a hardship. This is simply kicking them off the gravy train. Consumers would have some resistance. Some of them might not want to take responsibility for their own healthcare decisions. But we're simply asking consumers to accept the same responsibilities that buyers of homes or cars or computers face every time they make a purchase. If we can make consumers act like normal consumers and force suppliers by the introduction of a thrifty consumer to engage in price competition and act like suppliers do in normal markets, then the market will behave normally and prices will be driven downward as they are in other markets all around the world. And that's the basis for everything that I'm saying. If you agree with everything that you've heard, if it makes sense to you, then I would ask you to send this link to everyone that you know, ask them to view it, and if they agree, to pass the link along, because if we, the YouTube viewers, can spread this concept as far and as quickly as possible, we could have a real impact on solving the healthcare crisis, and we could prevent our government from making a very costly mistake. Thank you.